Hey guys, welcome to the Atlanta Heart Podcast. My name is Lincoln Parks, and I am here with Miss Amanda Lewis, nurse practitioner for Atlanta Heart. Amanda, welcome to the podcast.
Thank you. We're happy to be here.
Awesome. So before we even get into any questions or anything like that, just tell people a little bit about yourself and how you ended up at Atlanta Heart.
Well, I ended up at Atlanta Heart by I put in an application. I enjoyed cardiac as a nurse. I was a level 1 trauma nurse in Macon at the ER for about 8 years. And, in the ER, you see a lot of everything. You see traumas, you see heart attacks, you see, a broad spectrum of things. And one of the things that I really enjoyed was, I know this sounds weird, but going to the cath lab with patients and seeing the screen, how the heart caths are done and the immediate improvement of blood flow to the heart tissues. So when I got done with nurse practitioner school, I just kind of got burnt out on emergency nursing and decided it was time to move on. So when I finished school, I applied for Atlanta Heart, and they saw my history in the emergency room and all my, experience with cardiac patients in there. And I've been here for almost 7.5 years now.
Awesome. That's phenomenal. Yeah. So, all right. So I want to jump in and ask you, there's a lot of myths that are out there when it comes to heart health. So, and they're circulating out there in the community. So can you debunk some of the most common ones that listeners and those that are watching may encounter or hear from their friends?
So one of the main ones I hear from the patients that I see and their family members are, their wives will come with their husbands or their brothers or whoever, and it's, oh, I don't have heart disease, I'm okay. And I said, well, sometimes women actually have a higher death rate than all the cancers.
Wow.
So breast cancer, uterine, cervical, heart disease is actually the number one killer of women. And a lot of times it goes untested because we're just so busy doing other things. We're busy with caring for our parents, caring for the children, the house,
That's right.
working, shopping, grocery shopping, whatever it is. We're too busy doing other things to worry about ourselves and taking care of ourselves. So a lot of times it becomes an emergency. And that's when we end up in the emergency room because we don't take care of ourselves. We're too busy doing essential other things.
That's right. Yeah. And you know what, I could even say that for, with my wife. I know she's on the go, just constantly going and not really even checking in to see, about your health.
Right.
That's critically important.
We're short of breath one day and we'll say, oh, I'll go to the doctor tomorrow. And tomorrow the shortness of breath goes away. We forget about it. 6 months later, it's an emergency. So as women, we need to slow down and look at ourselves and think, okay, how do I feel? Is it my turn to go to the doctor? When's the last time I had blood work done? Or, what's my family history for heart disease? Do my parents, do my siblings, who has heart disease in my family that would be close to me that I need to worry about my heart health?
Yeah, that's important. And I hope everyone takes heed of that because like you said, we're always going and especially the women, because I see it in my family, just going back and forth and not really paying attention to themselves. So I'm glad you said that.
Yeah.
So next question I have for you is around diet and exercise. And, we live these busy lives and we juggle all these schedules. What are some like realistic heart healthy diet exercise tips that people can incorporate into their daily routines?
My biggest advice that I tell my patients is put your phone down. While you're sitting on your phone, you could be out walking. The more time you spend sitting, scrolling through whatever it is you're scrolling through, you could be up doing something productive. If it's just walking out to your mailbox, if it's walking around your house, if it's planting a flower, those simple things, even though they don't sound strenuous, if you're not used to doing them, they're a big deal to you. So the biggest thing is you make time in your day. If it involves getting up 20, 30 minutes early to go walk your neighborhood, to walk around your house, to get on a stationary bike, if you plan it and you set your alarm clock for it, you are more apt to do it versus, well, I may do it tomorrow. I may do it next week. And it's just one of those things that you say, stop procrastinating and do it. Don't start tomorrow, start today. And stop pushing it off and just do it.
I agree. And you know what? I was walking out this morning, and my wife just said, we need to go walking. We
Mhm.
need to just set
Absolutely.
a daily schedule to do it. So
Absolutely.
I mean, but what do you say what do you say to the moms? You know, they have a 2 year old and a 3 year old, and they're running around, and
I
when they
know.
get home, they got to cook, and they got so. I mean, how are they going to find the time to do it?
You're gonna wake up 30 minutes earlier.
There you go.
Because I have a
There.
10-year-old, I have a 2-year-old, and I'm here full time. And I get up early and I do my 45-minute an hour workout. I get dressed. Everybody's sleeping. My husband's sleeping. And that's my hour, hour and 15 minutes to myself. And that
Mm,
makes me feel better about myself. It makes me sleep better. It controls my blood pressure. It controls my weight. And I'm able to care for my family and my patients with a clear head, feeling healthy and better about myself, knowing that I've slept well, I've got up, I'm on track for the day, and it just makes your overall, um, appearance more comfortable to yourself.
yeah, yeah. Man, it's so important, and I'm glad you said that, to really have people, wake up earlier. Just
Hmm.
wake up, like you said, 30 minutes earlier,
Hmm.
to be able to do what you need to do while everyone's still sleeping,
Yep.
and getting a right amount of sleep, right? That
Oh
that's
yeah.
also a key. Yeah.
Absolutely, because that's actually one of the other topics. So we'll get to sleep in a minute.
Yeah, yeah, yeah. So okay, so let's move on. And we're talking about technology and heart health. And I know,
Yeah,
we mentioned technology a little bit. So you got the wearable tech. I have the Apple Watch, and people have all
absolutely.
these watches. So how can people leverage some technology?
So actually, this is a personal thing. My dad has an Apple Watch, and he actually sees Dr. Nelson, which I know you did a podcast with.
Yes.
Came in and told Dr. Nelson that his Apple Watch told him he has 11% AFib. So of
Mm,
course, Dr. Nelson put a monitor on him, and we found AFib. So it, it
wow.
is it is key to some of these diagnostic, because you can't wear a monitor your whole life. And my
That's right.
dad didn't feel anything, but his watch alerted him, and it actually assisted in the diagnosis of his AFib, preventing him from having a stroke, getting him on the right medicines.
Wow.
So, yeah, it was really key in diagnosing him, because he's been short of breath, but we couldn't figure out why till his Apple Watch started going off. So, little personal tidbit there.
No, no. I mean, that's actually pretty cool. Because I,
Yeah.
I have I have the Apple Watch as well, and I do look at my heart rate and look at
Mhm.
that, and I knew it had that feature, but who knew if it worked or not?
His
Who?
was
But I
accurate,
get
believe
it.
it or
It
not.
it, it
Now we
works,
have a lot of false positives, but
right?
from the Apple Watch saying you have AFib and it's not. But his was correct. Yeah.
Wow, man, that
Hmm.
is, and I'm glad, and I know you're appreciative that he had that
Oh, absolutely.
that Apple Watch for
Yes,
him. Man,
yes,
that's
yes.
awesome. So, family history
Hmm.
and risk. So, if someone in your family has heart disease, what proactive steps can they take to manage that risk?
Oh, definitely. So salt restriction is one of the key things for controlling your blood pressure, and maintaining a healthy weight, having your cholesterol checked, eating the right foods, and not everybody is a health nut. I understand that. We all go to
Yeah,
buffets, we all go to McDonald's. We live in America, okay? That's just what it is. But
right.
we have to make smart choices most of the time. I'm not saying
Yeah,
all the time, because we do want to eat what we want to eat. We all have our favorites, but most of the time we need to be conscious of what we're eating. Baked instead of fried, vegetables instead of French fries, cut down on some of our sugars, drink more
right.
water, less sodas, less Gatorade, less sweet tea, and I think you'll see a big improvement in your overall health.
Right, right, man. That is that. Look, I'm telling you, when we talk about people in your family and what they've been eating, typically
Hmm.
you just follow that same diet, and
You
you
do.
just eat the exact same way, and like you said, just limiting that, and just making sure that yeah, I like ice cream. I
Me
like the
too. I love
occasional
it. I
pie,
love
so,
cookies. Cookies is my
cookies,
weakness.
yes.
If you give me a cookie, it's over. I gotta eat it.
Right, right. I try to tell my wife, don't bring any Oreos in the house because
There
if you
you
do,
go.
I'm going to eat the whole thing. So just don't bring
Exactly.
them in there at all.
Yep.
Yeah. Okay. Awesome. Awesome. So okay. Um, the power of sleep.
Yeah.
We talk about sleep, and a lot of people know this, but we know sleep is crucial, to the
Mhm.
overall heart health. So, how does a quality sleep, specifically impact heart health?
So, actually, the American Heart Association has recently added sleep as one of its key features to maintaining and improving heart health because poor sleep habits, minimizing your sleep will actually cause increased blood pressure, and you
Mm,
are at risk for developing heart arrhythmias like AFib and PVCs and slower heart rates during the day and shortness of breath. So it's actually been shown that while you sleep and while you're getting restful sleep, your blood pressure decreases, your heart rate
mm,
decreases, and that allows your body to recover from the activities of the day before. So the more
mm.
restful sleep you're getting, the better your blood pressure will be. The better you will feel the next day, feeling rested and clear minded. And it also helps prevent water retention by reducing your blood pressure and heart rate.
Gotcha. So I guess that's why, I keep retaining all this water because I'm not sleeping enough. I guess that's what I'm not going to call it fat. I'm just going to call it water.
There you go. I'll agree with that.
All right. So, Amanda, and wrapping up, I just want to ask a question. So you talked about your husband, you talked about your two kids,
Yeah.
um, you know, uh, how, I know you guys like to do a lot of things together and in the community. So what's something that you guys do as a family or places that you like to go as a family, here in the community?
Well, we don't live in Henry County, but we
Yeah.
love to go to parks. I have a 10-year-old and a 2-year-old, and they love swings, they love slides, and I know this may sound a little weird, but my 2-year-old loves to cook. He loves to stir whatever it is
Okay.
I'm making, he stirs it. So
Okay.
that's our thing. He stirs it. My 10-year-old, she likes to be part of it too, opening and closing the oven door and stuff like that. So my husband he encourages it obviously because he wants to eat dinner and that's kind of what we do. So but we do a lot of family activities, parks, whenever we go to the beach once or twice a year, trying to get them out of the normal routine of just wake up, watch TV. We get them away from screen time as much as possible, stay active, stay
Absolutely.
outside.
Yeah.
um that's kind of what we do.
Yeah, well, it sounds like you have like some little chefs on your hands there. So,
Yeah, well, they're busy.
before, yes. So before long, they'll be cooking mom and dad a meal. So
That's
that's
my
awesome.
plan. Yeah.
Great, great. Well, Amanda, thank you so much for
Thank
jumping
you.
on and just
Yeah.
sharing your expertise and with everyone. So, guys, if you're listening to this and you're watching it, make sure you stop into Atlanta Heart and you ask for Amanda, because she's one of the best there, and she's going to take care of you and help you with your heart health, even if you don't. Again, if you're not feeling anything, if it's something that you just want to come in for a preventative check, Amanda, they can do that, right?
Absolutely. We can do same day treadmills, ultrasounds. You don't have to be having a problem just to get screened. Absolutely.
Awesome, awesome. Well, Amanda, again, thanks for joining the podcast
Thank
and
you.
truly appreciate the time.
Thank you.
Take care.
Bye bye.